Thank you, Kirk, and thanks, Brent, for the introduction, and thank you to the National Academy for inviting me. I'm Matthew McHugh from the University of Pennsylvania School of Nursing. And I'm going to start by raising a question, and it's one that I hope that you keep in mind throughout the symposium today as we discuss the success and some of the challenges that remain since the publication of these landmark reports. And the question is, could insufficient organizational improvement be impeding our patient safety improvement progress? So, in particular, I'm going to focus on the nurse work environments. This is one of the 10 Quality Chasm series reports that Dr. Zhao mentioned, titled Keeping Patients Safe, Transforming the Work Environment of Nurses. And in that report, they highlighted the essential link between nurse work environments and quality of care and patient safety. Let's take a step back and say, what is a good work environment? What includes having adequate staffing and resources. Nurses are given and expected to exercise their professional autonomy on behalf of patients. Management supports nurses when they make those decisions. Nurses' voice on issues of patient safety is taken seriously. They report that the door is broken in those institutions. Physician colleagues respect and value nurses' contributions to patient safety. And culture. The culture of the organization expects all healthcare providers to be working together under the banner of patient safety. Now, importantly, a key finding of this report was that in environments where in hospitals where work environments are better, patient safety is better. There are fewer hospital-acquired conditions and infections, fewer adverse events and errors. Outcomes are better, lower mortality rates, readmissions, and patient satisfaction is higher. But as I'm going to show in some of the slides that follow, and this is the glass half empty part of the talk, we still have a significant way to go in order to create the kinds of environments that this report envisioned. Over the past 2.5 decades, our Center for Health Outcomes and Policy Research at Penn Nursing has surveyed hundreds of thousands of nurses. And our explicit purpose is to ask them about the environment in which they work and how that links with patient safety. In 2015, our most recent survey, it included over 20,000 bedside direct care nurses in over 900 hospitals. And we focus on nurses not for nursing's sake, or I happen to be a nurse and I'm interested in what they say, but because they are uniquely positioned. They have an important viewpoint and a vantage point into patient safety issues. They're at the bedside 24/7. They're with patients from the moment that they come into the hospital through the moment that they're discharged. And they're working with all the other providers, and they see the consequences of top management decisions firsthand. Unfortunately, what nurses say, and again, this is 2015 data, should give us pause and make us think about what we need to move forward. Now, there is progress, but still 1 in 3 nurses report that they work in an environment that is fair or poor, the lowest categories. Half of nurses say that there are insufficient nurses to provide quality care in their setting. More than half lack confidence that management will take what they say seriously around patient care issues and act on it. And 1 in 3 nurses is burned out. That means on a day-to-day basis, they're overextended, depleted of physical and emotional resources, they detach and depersonalize patients, and they lack engagement in their work. Clearly, that's not the kind of environment envisioned by this report or the Tueris Human Report. So continuing, nurses also tell us that safety remains a problem. 1 in 3 nurses give their hospital a grade of C or lower in terms of overall patient safety. And similarly, 1 in 3 give hospitals a grade of C or lower in terms of infection prevention. Tellingly, half of nurses would not recommend the hospital in which they work to a family member or a friend if they required hospital care. And finally, nurses say that a culture of patient safety is simply lacking in many of the institutions in which they work. Unfortunately, 3 of 4 nurses feel like mistakes and errors will be held against them. There's obvious implications for monitoring, reporting, and then responding to patient errors in an environment like this. Half of nurses don't feel that management will take what they say seriously, and they feel that when they question authority, that will be problematic for them. 1 in 3 nurses are frequently interrupted by operational and system failures that are entirely preventable. Broken doors, broken equipment, missing medications, a lack of other colleagues working with them to provide safe care. And finally, over a third report that patient safety is not a top priority from their perspective, a top priority for management. So my perspective is that the real actionable contribution of the reports that we're celebrating today is not just highlighting patient safety as an important public health issue, but really placing it squarely as an organizational attribute. It is a property of the organization. I think that much of the work that we have done over the past 15 years, unfortunately, has not focused as much on the environment, but on individual programs and interventions, and still at the individual level rather than the systems level. And I fear that without a focus on the organization and the system, we should only expect marginal gains going forward. Now, this is the glass half full part. There's good news. All of the things that I've talked about, they can be changed. And many organizations, many of them represented here, have done the kinds of things that are necessary to turn work environments around. That includes flattening hierarchical structures. It means adequately resourcing nurses. It means identifying that nurses really are a prime driver in patient safety and outcomes. And it's an expectation that nurses are fulfilling and driving surveillance for patient safety issues. I think our challenge going forward is to make the best work environments the norm rather than the exception. That will require reform. It will require investment, and in many cases it will require real dollars. But more than anything, it requires looking inward at the culture and making change. But that's why we're here. Thank you very much.